understand that we still can't say for sure that fibromyalgia is passed genetically from parent to child, but we know there's some genetic component. My mother and I, a female, both were diagnosed with fibromyalgia, and I just gave birth to my daughter a few months ago. Congratulations. I'm wondering, what's the likelihood of her getting fibromyalgia? Well, you're 8.5 times more likely to have fibromyalgia if you have a first-degree relative with it compared to the general population. And that's huge. If you look at other illnesses like lupus and rheumatoid arthritis that have a genetic component, if you have a first-degree relative with it, you're 2 times more likely. So we're 8.5 times more likely. And I take care of 3 families where both the mother and father have fibromyalgia, and if the mother and father both have it, then all of their children will have it. Okay, so one thing that I learned very early in training with Dr. St. Amand is that even though you might have fibromyalgia, meaning that you have nodules in your left anterior thigh, you might not have symptoms. So he talked to me about a woman who was brought into his office by her sister. And Dr. St. Amand examined the woman, and she was having a lot of symptoms. She had left anterior thigh nodules. And on the way out, he asked to examine her sister, because now that he knew she had it, he wanted to know if her sister did it. Yes, she had nodules. She was totally asymptomatic. So the important take-home message is that Dr. St. Amand and I don't treat anyone unless they have symptoms, because we don't know if they will ever develop symptoms. No study has ever been done on that. So if you think about your families, you might have a number of your relatives that have left anterior thigh nodules, but they don't have symptoms. At the bottom of the body map that Vicki uses, I use, that Dr. St. Amand made, are the most common symptoms in fibromyalgia. The way that these symptoms got on this list is that at least 33% of people with fibromyalgia had to have those symptoms. So what I tell my patients who are wondering if, let's say, their son or daughter or niece might have fibromyalgia, I say, well, ask them about these questions. And treatment can be done if they are having symptoms that are significantly affecting their lives. Guaifenesin is approved for children 2 and older by the FDA. So we do not map children until they're 2, because what would we do about it anyway? And we only map, of course we're happy to map people for information, but we wouldn't recommend treatment unless they have symptoms. Next question. From what I have read, and yes, in the paper that I made with all of the studies, it does talk about a couple studies where there have been areas on, say, chromosome 17 that have been implicated. University of Cincinnati researchers have found an area on chromosome 17 that could code for the disorder. I think that one of the reasons there isn't a blood test yet is there are probably areas on multiple chromosomes. Annette might have an area on chromosome 17 that codes for it. I might have an area on chromosome 9 that codes for it. It's not all chromosome 17, because boom, if it was that the lab test in the computer analysis would have showed that. Anyway, all right. So yes, there is a strong genetic component.